everyone, and welcome back to English Pod. My name is Marco.
And my name is Catherine, and today we might just teach you how to save a life.
That's right, we're going to save a life, and we are going to do this by applying first aid.
So let's take a look at vocabulary preview and find out just exactly what this phrase means.
Vocabulary preview.
Okay, so we have this word first aid. It's two parts. So first is... Before.
Early.
All right. And aid. So when you aid someone, you help them, right?
Right. So this is actually a noun. Aid is help. So we're applying first aid. This means we're the first person to come and help someone. So for example, if someone is bleeding, the first aid is to stop the bleeding.
Okay.
All right. So first aid, we're going to learn all about this. Take a listen to today's dialogue, and we'll be back in a moment.
Hey Joe, where have you been these past few days?
I've been busy with a first aid course that I started about a week ago at the Red Cross.
Cool! I've always wanted to do something like that. Have you learnt anything useful?
For sure. I mean, we learned how to apply pressure to stop bleeding, how to check for a pulse, and even how to apply CPR.
Have you treated any real emergencies?
Well, they took us along with some paramedics. There was this guy who fell off his motorcycle and suffered a concussion as well as a couple of compound fractures. His wounds were pretty serious, so they had to rush him to the hospital. It was intense.
I can imagine. I tend to faint when I see blood, so I think I won't be taking up a course like that anytime soon.
All right, we're back. So there are a lot of medical and health-related terms in this dialogue, so why don't we take a look at a couple of those in Language Takeaway.
Language takeaway.
Well, starting us out here in Language Takeaway, we have the name of an organization that's not-for-profit, that's very, very, very famous. This is called the Red Cross.
Okay, so the Red Cross. And this is usually a place where you donate blood. You can also get some blood exams done. What else do you do there?
Well, the Red Cross is an organization that has offices and clinics all over the world. And if you want to help, you can volunteer, you can donate money, and you can donate blood. But the Red Cross will take this and it will help other people who have been in disasters or wars. And so maybe the Red Cross office near you will have blood banks and blood donations. But really, they help people, they provide aid to people who are unhealthy or sick or have been in a war.
A very humanitarian organization, so worth it. Go to the Red Cross and donate blood.
In the dialogue, the two people are discussing real emergencies, and one person says he went along with some paramedics. So a paramedic is a person.
It's a person. It's a profession, right? To be a paramedic.
Exactly, but it's not really a doctor. So what's the difference here?
So paramedics are something like nurses, right? That travel in an ambulance and get to an emergency or get to the scene of an accident and help out a person. So they immobilize the person, they give them oxygen, they make sure that they stay alive until they reach the hospital.
Okay, so a paramedic, you might hear the word medic, it's the same thing. A paramedic is like a nurse. They're not a doctor, but they're usually the first person to help when there's been an accident or a disaster.
Right, exactly. So if there is an earthquake and many people are stuck in the buildings, usually paramedics will be the ones on the scene trying to get them out and helping them by applying first aid.
Great. Well, after that, we have finally some of the injuries that a paramedic might see. The first injury is usually associated with the head. This is called a concussion.
You suffered a concussion.
Sounds painful.
Yeah, it does. And actually, it's very common, I think, right? If you fall and you hit your head.
That's right. So a concussion is really when your brain hits your skull. That's the bone that protects your brain. So really, you're hitting your head really, really hard. And usually this can have some bad side effects, like you lose your memory or you're a little bit confused. It's very common with football players.
Yeah. With any contact sport, if people suffer concussions, and it's just like, imagine when you have a DVD player and you hit it and the disc skips or it goes back. That's kind of what happens to your brain, so you can suffer memory loss. You can even lose your sight temporarily.
That's right. So this can be very serious and obviously should be looked at by a paramedic. We also have another situation that is similarly serious. It's called a compound fracture.
Okay, so what is a fracture or to fracture?
A fracture is a thing. It's a break. Okay, so you could say, I broke my arm. But you could also say, I fractured my arm. This
Okay.
is the more medical term. But of course, there are different ways to break something. And so in medicine, we have a compound fracture.
So a compound fracture is pretty painful, and it's a little bit more serious. You have a simple fracture, which is when your bone just breaks.
Or a hairline, which means that there's a little thin part where it's broken, but it's not really serious.
In this case, it's your bones actually push towards each other. They kind of form like a little mountain, right? Or they're on top of each other.
Think about when two cars hit and they kind of crash up into each other.
Exactly.
It's like that, but it's your bone. So it's extremely painful.
Yeah, it's very, very painful. So the person suffered a concussion and a compound fracture. Now, the friend that he was talking to said, wow, it sounds amazing. It's really cool that you're doing that. But you know what? I faint when I see blood.
Do you do this?
No.
No, me neither. Well, some people, when they see blood, they feel very, very uncomfortable or sick. And so to faint is to fall down on the ground. It's
Right.
almost like you're falling asleep, but it's not sleep.
Have you ever fainted?
I fainted twice in my life. One time I fainted because of heat. It was
Right.
very, very, very hot. And I couldn't breathe for a moment, and then I woke up on the ground.
Wow. Yeah.
Yeah.
That's what happens.
Exactly.
So, if you ever faint, it's basically that you're just standing there, you're sitting somewhere, and all of a sudden everything goes black, and you wake up and you're on the ground.
And you feel very, very weak before that.
And very pale, I think, as well. Because
Yeah,
you
your
look
blood
pale.
goes away from your brain,
Yeah.
and you pass out. It's a very strange sensation.
It is.
Because then everyone else around you, they know what happened. They saw you, and so they're looking at you like you're crazy or maybe sick.
Right.
To faint.
All right, so that's to faint. So those are the key words that we have for you on Language Takeaway. Let's take a listen to our dialogue again, and we'll be back shortly to take a look at some phrases on Fluency Builder.
Hey, Joe, where have you been these past few days?
I've been busy with a first aid course that I started about a week ago at the Red Cross.
Cool. I've always wanted to do something like that. Have you learnt anything useful?
For sure. I mean, we learned how to apply pressure to stop bleeding, how to check for a pulse, and even how to apply CPR.
Have you treated any real emergencies?
Well, they took us along with some paramedics. There was this guy who fell off his motorcycle and suffered a concussion as well as a couple of compound fractures. His wounds were pretty serious, so they had to rush him to the hospital. It was intense.
I can imagine. I tend to faint when I see blood, so I think I won't be taking up a course like that anytime soon.
All right, so quiz, Marco. What is the first thing that a paramedic does when he or she finds a body at an emergency?
That paramedic checks for a pulse to make sure you're alive, right?
Right, a pulse. So, thum, 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 thum. The pulse is the rhythm, that's the sound of your heart pumping blood. And you can feel someone's wrist or their throat. So to check for a pulse means to check and make sure their heart is pumping blood.
Right. And not only that, but to make sure that the heart is pumping blood relatively normal, because sometimes your heart can be pumping blood too fast or too slow.
And if it's too slow, it's very possible that you will faint.
Very good. All right, so we check for a pulse. Now, what else happens?
Well, if there's a very serious emergency and the paramedic needs help to give aid to the person who is injured, then they will rush that person to the hospital.
Okay, so the verb to rush. What does that mean?
All right, so to rush someone or to rush someone to the hospital means to take someone or to go with someone very, very quickly. Okay, so let's give an example. I could say, listen, Marco, I don't want to rush you, but I really need the report done today.
Or I could say, I need to rush home. My parents need me.
Or if a woman is having a baby, you want to rush her to the emergency room.
Right. Okay, so you need to go quickly. All right, now when we were talking about fainting, the person said, before he used the word faint, he said, I tend to faint.
Okay, I tend to. I tend to is a really great verb that describes a normal or habitual behavior. That's like saying, I tend to faint when it's very, very hot outside. That means I often faint when it's very, very hot outside. It's something that happens normally.
So it's a tendency.
Right, but it's not for everyone. It's for me. So I tend to. What's something that you tend to faint when you see?
I never faint.
You don't
I'm
faint?
a man. No, just kidding. But you know what? I tend to leave the towel on the bed sometimes after I take a shower. I know, it's a bad habit.
And then the sheets smell.
No, they don't, because I leave it there for like 5 or 10 minutes and then I realize, I'm like, oh my God. And then I pick it up. But, it's hard
That's
to...
gross.
No, it's not.
Well, I tend to forget my leftover food in the refrigerator for a long time.
Oh, that's
and
even-
then it starts to smell.
That's gross.
But I don't like to waste food.
But you let it rot and then your fridge smells.
It happens. So that's all we've got for Fluency Builder today. But we can talk about tendencies in a moment. Maybe a homework assignment could be to think of something that you tend to do.
That's right. That could be an interesting homework assignment. But before we jump into that, why don't we listen to our dialogue for the very last time?
Hello and welcome to the English Podcast Zone. I'm really glad you're here today because we're diving into something incredibly important, first aid. Now, don't worry, we're not going to get overly technical or turn this into a medical lecture. This is all about practical English in real-world situations, stuff that could actually help you save a life and sound natural in English while doing it. So, let's begin by understanding what first aid really means. It's the immediate help you give to someone who's injured or suddenly becomes ill, right before professional help arrives. It's called first because it's the first response. And aid just means help. So, first aid equals first help. Now, here's a real-life situation. Imagine someone suddenly falls off a bike right in front of you. They're bleeding from their leg and look confused. You don't just stand there, right? You check if they're conscious, apply pressure to stop the bleeding, and call for help. That's first aid in action. Let's talk about some useful verbs and phrases that are essential when you describe these situations in English. One of them is apply pressure. This means to press firmly, usually on a wound, to stop bleeding. For example, I applied pressure to the wound with a clean towel. Another common verb in first aid is check for a pulse. Pulse is the rhythm of the heartbeat. You might hear someone say, check the neck or wrist for a pulse. This tells you if the heart is still beating. And of course, there's CPR, which stands for cardiopulmonary resuscitation. It's used when someone has stopped breathing. Even just saying, I learned how to perform CPR in a training course is a great way to use this term in conversation. But what if you're not sure how to describe an injury? Try these useful expressions. He suffered a concussion. A concussion is a type of head injury. She broke her arm. It was a compound fracture. This means the bone broke and possibly pierced the skin. They had to rush him to the hospital. To rush means to take someone quickly. See how natural and useful this language is? These expressions are not just for emergencies. You can use some of them in everyday situations too. For example, I had to rush to work this morning, or I tend to feel dizzy when it's too hot. That verb tend to is super useful. It means something happens often or is likely to happen. I tend to faint when I see blood is a great example. Now here's a small grammar point. When you use tend to, it's usually followed by the base form of a verb. For example, I tend to forget names. She tends to panic in stressful situations. They tend to arrive late. So by learning about first aid, you're not only getting life-saving knowledge, you're also learning verbs, collocations, and patterns that make your English sound natural and confident. Let's end this part by learning one more phrase, first aid kit. This is a small box or bag that contains medical supplies, like bandages, antiseptic wipes, and gloves. You might say, I keep a first aid kit in my car just in case. Just in case is another super useful expression. It means in case something unexpected happens. When you think of emergencies, it's easy to imagine flashing lights, sirens, and chaos. But what actually makes a difference in those first few minutes isn't always the ambulance. It's the person who's standing right there when something happens. That person could be you. And in English, being able to describe or respond to emergencies clearly and calmly is a powerful skill. Let's start by looking at the idea of staying calm under pressure. This is something people say a lot during first aid training. The phrase under pressure means during a stressful situation. For example, she stayed calm under pressure and helped the injured child. That's the kind of English you'll often hear in news reports or even in job interviews. Now imagine this: someone collapses during a meeting. What would you do? First, you need to assess the situation. In English, we use the word assess to mean check or evaluate. You might say, I assessed the scene to make sure it was safe. This is especially important before giving any kind of first aid. After that, one of the most basic steps is to call emergency services. Depending on where you are, you might call 911 112 or another local number. In English, we often say things like, I called for help. We dialed emergency services immediately. She contacted the paramedics right away. The word paramedics refers to trained emergency medical workers who usually arrive in an ambulance. They aren't doctors, but they have special training to deal with urgent medical problems. A very natural sentence might be, the paramedics arrived within minutes and took over. Let's also look at a few more expressions that are helpful in these situations. He lost consciousness. This means the person fainted or blacked out. She regained consciousness. That means she woke up again. We had to keep him awake until help arrived. This is something you might do if someone has a head injury. And what about wounds? In English, the word wound can be a noun or a verb. He had a deep wound on his arm, or he was wounded in the accident. You can also talk about treating a wound. To treat means to give care or medical help. Here's a quick vocabulary tip. English uses a lot of phrasal verbs when it comes to emergencies. These are 2 or 3 word verbs that include a verb plus a preposition or adverb. Some examples: pass out, to faint. He passed out from the heat. Come to wake up after fainting. She came to after a few minutes. Throw up, to vomit. He threw up after the accident. Black out, to lose consciousness. I blacked out for a second. These expressions are common in both spoken English and casual writing, like stories or conversations. And let's not forget about the phrase in case of emergency. You'll see this everywhere, in hotels, airplanes, and office buildings. For example, in case of emergency, use the stairs. This phrase is very formal and useful when talking about safety plans. Now let's connect all this language into a natural sentence. In case of emergency, remain calm, assess the situation, and call for help. Try to keep the person awake if they've lost consciousness, and wait for the paramedics to arrive. As you can see, first aid is not just about physical actions, it's also about communicating clearly. Whether you're telling someone what happened, giving instructions, or asking for help, your words matter. And in English, the more natural and confident you sound, the more helpful you can be in any emergency. One of the most important things to remember about first aid is that it's not always dramatic. Sure, sometimes there are serious injuries, but often it's the small things that make a big difference. Like knowing how to handle a burn, a nosebleed, or someone who's choking. These are everyday situations where quick thinking and the right English can really help. Let's begin with burns. In English, we describe burns by their severity: first degree, second degree, and third degree. A first-degree burn is the least serious. The skin gets red, maybe a bit swollen, but there are no blisters. You might say, I accidentally touched a hot pan and got a mild first-degree burn. When giving first aid for a burn, you can use phrases like, run cool water over the area for several minutes. Avoid putting ice directly on the burn. Cover it with a clean, dry cloth. Another common situation is a nosebleed. These happen all the time, especially in dry weather or after a minor injury. But many people panic. In English, the basic advice is, pinch the nose just above the nostrils. Lean forward slightly, not backward. Breathe through your mouth until the bleeding stops. A useful phrasal verb here is stop up. You might hear he used tissue to stop up the bleeding. That just means to block or plug the bleeding area. Now let's talk about something very serious and time-sensitive, choking. When someone is choking, they can't speak, breathe, or cough properly. In English, we often say, "He started choking on a piece of food. She couldn't breathe, so I performed the Heimlich maneuver." The Heimlich maneuver is a first aid technique used to dislodge food or objects from someone's airway. You can also use simpler phrases like, "I helped him cough it up." "I hit his back to help him breathe." And here's a great expression to learn, act fast. This means respond quickly. For example, when she started choking, I knew I had to act fast. It's a phrase you'll hear in both emergency training and everyday conversations. Let's pause here to talk about giving instructions in English. First aid often involves telling someone what to do, and that means using clear, direct commands. In English, we usually drop the subject you and go straight to the verb. For example, apply pressure to the wound. Call an ambulance. Don't move him. Check if she's breathing. These are called imperatives, and they're powerful tools for giving clear directions, especially in emergencies. And if you're on the phone with emergency services, here are some key phrases you might need. There's been an accident. Someone is injured. He's unconscious but still breathing. We need help right away. Try practicing these phrases so you can say them clearly and confidently if the moment ever comes. So remember, even small injuries like burns and nosebleeds deserve attention. Knowing how to describe symptoms, give instructions, and stay calm in English can help you handle unexpected situations like a pro. That's what first aid is all about, being prepared, being helpful, and being clear. Let's take a moment to focus on something that isn't talked about enough in first aid: prevention and preparation. Most people only think about first aid after an emergency has already happened. But being prepared is a big part of helping others, and that includes knowing the right vocabulary and expressions in English to talk about risks, safety, and being ready. One of the most useful phrases in English for talking about safety is just in case. You can use this to explain why you carry something or why you do something in advance. For example, I always carry a first aid kit just in case. I keep bandages in my bag just in case someone gets hurt. Simple but extremely natural and common in conversation. Now let's talk about a first aid kit. What's in it? And more importantly, how do we talk about these items in English? Here are some essentials and the typical English words for them. Bandages for covering small wounds. Antiseptic wipes to clean cuts or scrapes. Gauze pads to stop bleeding and protect injuries. Adhesive tape to keep gauze or bandages in place. Tweezers used to remove splinters or small objects. Gloves, usually disposable and used to protect both you and the injured person. Scissors, often included for cutting tape or clothing. So how would you describe this in conversation? You might say, "My first aid kit has everything I need for minor injuries. I replaced the bandages and antiseptic wipes last week." Always wear gloves before treating someone to avoid infection. That word, infection, is another important one in first aid English. An infection happens when germs enter a wound and cause redness, swelling, or pain. To prevent infection, you might hear, "Clean the wound thoroughly." Use an antiseptic before applying a bandage. Watch for signs of infection like increased pain or pus. And speaking of preparation, another helpful expression is better safe than sorry. This is a common way of explaining why someone takes precautions. For example, I know it's a little extra weight, but I carry a full first aid kit, better safe than sorry. Let's add a few more useful verbs and expressions related to preparation. Stock up on, to collect or buy supplies in advance. I stocked up on bandages and gloves. Be equipped with, to have something necessary. The campsite was equipped with a basic first aid station. Take precautions to act in a way that prevents danger. We took precautions to avoid sunburn and dehydration. And if you ever describe an emergency or a time you used your first aid kit, try including time phrases to make your storytelling more natural. A few weeks ago, out of nowhere, someone fell. Luckily, I was prepared. Putting it all together, a natural way to describe a situation might be, a few weeks ago, I was hiking with some friends when one of them tripped and scraped her leg. Luckily, I had my first aid kit with me. I cleaned the wound, applied some antiseptic, and covered it with a bandage. Better safe than sorry. As you can see, being prepared isn't just about having supplies, it's also about having the right words ready. Whether you're explaining what's in your kit, talking about precautions, or sharing a past experience, your English can make you more confident and more helpful in any situation. Now let's explore one of the most critical skills in first aid, and a very useful area for English learners: describing symptoms clearly. Whether you're helping someone or calling emergency services, being able to describe what's happening in simple, accurate English can make a real difference. Let's begin with physical symptoms. In English, we use very specific verbs and expressions to describe how someone feels or what their body is doing. Here are some of the most common. He's bleeding heavily. This means blood is coming out fast and the situation may be serious. She's shivering. That's when someone is shaking from cold or shock. He's sweating a lot. This could be a sign of heat exhaustion or even a heart issue. She's having trouble breathing. This is a very serious symptom and should be reported immediately. He says he feels dizzy. Dizzy means your head feels light and the room might feel like it's spinning. Now, here's a key expression, complains of. It's used when someone tells you they are experiencing pain or discomfort. For example, she complains of chest pain. He's complaining of nausea and a headache. This phrase is very common in hospitals or when talking to a doctor or paramedic. It's a bit formal but very clear and useful. Let's look at some specific types of pain and the words we use to describe them. Sharp pain, intense and sudden. He felt a sharp pain in his chest. Dull pain, more constant but not severe. She had a dull pain in her lower back. Throbbing pain, a pulsing, rhythmic feeling. He described a throbbing pain in his leg. Stabbing pain, like being poked with a knife. She had stabbing pain in her side. These words can help you give more precise information. If you ever have to speak to a medical professional in English, saying sharp chest pain is much more helpful than just, I feel bad. You should also know some phrases for common conditions. He feels nauseous. That means he feels like vomiting. She's lightheaded. This is similar to dizzy and often comes before fainting. He lost consciousness for a moment. This means he fainted or blacked out. She's responsive. This means she can answer questions or follow instructions. He's unresponsive. That means he's not reacting at all. This is very serious. When you're speaking to emergency services or explaining an incident later, it's helpful to use time expressions to describe when things happened. He started feeling sick about 10 minutes ago. She's been unconscious for 2 minutes. He suddenly collapsed while we were walking. And don't forget to use transitional phrases to make your story smoother. At first, he seemed fine. Then, he started having trouble breathing. After that, we called for help. These transitions help your English sound more natural, especially in storytelling or reporting. Here's a short example of how all this might come together. At first, she just looked a little pale, but then she said she felt dizzy and nauseous. A minute later, she fainted. I checked for a pulse, she still had one, and then I called an ambulance. I told them she had lost consciousness but was breathing. They arrived quickly and took her to the hospital. As you can see, knowing how to describe symptoms with the right vocabulary and sentence structure can help you explain things clearly, stay calm, and assist more effectively in an emergency. And those are skills that go beyond language. They build your confidence and readiness in real life. Let's turn our attention now to something extremely important in first aid: recognizing and reacting to serious medical conditions. These are situations where time is absolutely critical, and being able to describe the signs and respond appropriately in English can help save someone's life. Let's start with one of the most common medical emergencies: a heart attack. In English, when someone is having a heart attack, people often describe it like this: he's clutching his chest. That means he's holding his chest because of pain. She looks pale and is sweating heavily. He says he feels a crushing pain in his chest. She's having difficulty breathing. All of these are classic warning signs of a heart attack. If you ever have to report this to someone, especially emergency services, you could say, "I think he's having a heart attack. He has chest pain, shortness of breath, and is sweating a lot." Now here's an important expression: shortness of breath. It means the person cannot breathe normally. This is common in heart attacks, asthma attacks, or allergic reactions. For example, she's experiencing shortness of breath. He can't catch his breath. Next, let's look at strokes. A stroke is when the blood supply to part of the brain is cut off. There's a very useful acronym in English to recognize the signs of a stroke: FAST. F is for face, ask the person to smile. Is one side drooping? A is for arms, ask them to raise both arms. Does one drift downward? S is for speech, ask them to repeat a sentence. Is the speech slurred or strange? T is for time, time to call emergency services immediately. When reporting a stroke, you could say, she's showing signs of a stroke. Her speech is slurred and one arm is weak. His face is drooping on one side. Another common emergency is an allergic reaction. The most dangerous kind is called anaphylaxis, and it happens very fast. In English, you might hear, he's having a severe allergic reaction. Her face and throat are swelling. He's breaking out in hives and can't breathe. She needs an EpiPen. An EpiPen is a device that gives a quick dose of medicine called epinephrine. It's often used for people with severe allergies. You might say, I gave her the EpiPen. He has an EpiPen in his bag. These are all situations where you need to act immediately. That's another common English phrase. For example, if someone is unconscious and not breathing, you must act immediately. We acted immediately when we saw she was choking. Let's also go over some useful verbs and phrases that can describe worsening conditions. His condition is deteriorating. That means it's getting worse. She's fading in and out of consciousness, going back and forth between being awake and unconscious. He's not responding to questions. Her breathing is getting weaker. These expressions are especially useful when speaking with paramedics or medical professionals. And here's a sentence that puts everything together. His face was drooping and he couldn't raise his left arm. I suspected it was a stroke, so I called emergency services right away. I told them he was slurring his speech and that the symptoms had started about 5 minutes earlier. Knowing how to describe these serious conditions clearly and calmly in English can make a huge difference. You're not just learning words, you're learning to respond, to help, and to communicate effectively when it matters most. That's what makes this kind of language so powerful. Let's shift the focus to something that often gets overlooked in first aid conversations: emotional responses and how to stay in control during high-stress situations. This is just as important as knowing how to treat a wound or perform CPR, because staying calm and communicating clearly can make all the difference. In English, we have many ways to describe fear, anxiety, and panic in emergency situations. You might hear someone say, I froze when I saw all the blood. He panicked and didn't know what to do. She was in shock and couldn't speak. Let's look at some of these expressions more closely. To freeze in an emergency means to stop moving or thinking clearly because of fear or stress. To panic means to lose control emotionally and mentally. To go into shock can mean two things. In a medical sense, it refers to a dangerous drop in blood flow, but more often in everyday English, it simply means someone is extremely confused or stunned after a traumatic event. When helping someone, you also need to manage your own stress. Useful phrases you might hear or use in English include: take a deep breath and stay focused. Try to stay calm and think clearly. Keep your voice steady and give clear instructions. These aren't just motivational phrases, they're actually part of good first aid communication. If you're helping someone who's scared or hurt, your calm tone and clear language can help them feel safer. Let's say you're with someone who's been in a car accident. They're scared, maybe in pain, and not thinking clearly. Here's how you might speak to them. You're going to be okay. Help is on the way. Just try to breathe slowly. I'm right here with you. Can you tell me your name? Stay awake if you can. Simple, reassuring language makes a huge impact. Even your choice of words matters. Instead of saying "don't worry" or "calm down," which can sometimes sound dismissive, it's more effective to say, "You're safe now. Help is coming." Let's focus on your breathing together. Let's also learn the phrase "take charge." In English, this means to take control of a situation, especially when others are confused or frozen. For example, she took charge of the situation and started giving first aid. He stayed calm and took charge while others panicked. Another useful phrase is "think on your feet." This means to make quick decisions in unexpected situations. You might say, "You really have to think on your feet during emergencies." Now here's a great way to use all of this in a real-life example. I saw the cyclist fall hard on the sidewalk. A few people froze, unsure of what to do. I took a deep breath and tried to take charge. I told someone to call emergency services while I checked if he was conscious. He was confused and bleeding from his arm. I kept my voice calm and said, "You're okay. Help is on the way." I tried to keep him talking until the ambulance arrived. That's the kind of calm, confident, and helpful English you want to be able to use, not just in first aid situations, but in life in general. Remember, it's not about being perfect. It's about being prepared and staying composed. The more natural and supportive your language is, the more effective and reassuring you'll be in any crisis. Let's now focus on one of the most valuable but less dramatic aspects of first aid: dealing with minor injuries and everyday incidents. These are the kinds of situations that happen all the time, at home, at work, or even while traveling. They might not require an ambulance, but they do require clear thinking and the right English vocabulary to handle them properly. Let's start with cuts and scrapes. These are probably the most common types of injuries. When describing them in English, people might say, "I got a small cut on my finger while cooking." "She scraped her knee when she fell." "He has a deep cut and it's still bleeding." To give first aid for a minor cut, here are some phrases you might use. Clean the wound with water and soap. Use antiseptic to disinfect the area. Cover it with a bandage to keep it clean. Notice the verbs used: clean, disinfect, cover. These are all practical, useful words you can apply to dozens of everyday situations. You can also add time phrases like, "Do this immediately after the injury." "Keep the bandage on for at least a few hours." "Check the wound daily for signs of infection." Another common issue is bruises. A bruise happens when blood vessels under the skin break, usually after you bump into something. In English, people describe it like this: "He has a nasty bruise on his arm. It turned purple and swollen the next day." "She bruised her leg during the game." For treatment, you can say, "Apply a cold pack to reduce the swelling." Elevate the injured area. Avoid touching or pressing the bruise. And then there are sprains and strains. A sprain affects the ligaments, like twisting your ankle, while a strain affects muscles. In casual English, we often just say, "I twisted my ankle." "He pulled a muscle in his back." "She can't walk properly, it might be a sprain." Treatment is usually described using the acronym RICE in English: rest, ice, compression, elevation. So you might hear, you should rest it for a few days. Apply ice every 20 minutes. Use a bandage to compress the area. Keep it elevated to reduce swelling. These sentences use simple structure, but they're full of useful medical and health vocabulary. Now, let's look at another situation you might face: insect bites or stings. In English, you can say, I got stung by a bee. He has a mosquito bite, it's really itchy. She had an allergic reaction to a wasp sting. For minor reactions, you might say, wash the area with soap and water. Apply a cold compress to reduce swelling. Use anti-itch cream if it becomes irritated. One more phrase that's helpful in these cases is over-the-counter. This refers to medicine that you can buy without a prescription. For example, you can take over-the-counter painkillers like ibuprofen. There's an over-the-counter cream for insect bites. And finally, here's a full example that shows how to put all this language together. I accidentally cut my hand while slicing vegetables. It wasn't too deep, but it was bleeding. I washed it with warm water, applied antiseptic, and covered it with a clean bandage. The next day, there was some bruising around the area, but no signs of infection. I've been checking it daily and changing the bandage as needed. Everyday injuries are part of life. But knowing how to describe them, treat them, and talk about them confidently in English gives you a powerful set of tools, not just for emergencies but for daily communication. Whether it's a scraped knee or a sore ankle, the words you use matter. And the more natural your English becomes, the more helpful you can be. Let's talk now about something that brings everything together: what to do after the emergency is over. Providing first aid doesn't end when the situation is under control. Often there are follow-up steps, ongoing care, and conversations that happen afterward. Being able to talk about recovery, updates, and lessons learned in clear, natural English is a valuable skill. Let's begin with how to check in on someone after an incident. In English, we often use the phrase follow up to describe checking again or continuing to take care of something. You might say, I followed up with her the next day to see how she was feeling. They followed up with the doctor to make sure everything was healing properly. You should follow up on that wound and make sure it doesn't get infected. Other useful phrases for showing care include, how are you holding up? This is a gentle, supportive way to ask how someone is doing emotionally or physically. Let me know if you need anything. Don't hesitate to reach out. When talking about how someone is recovering, here are some helpful expressions. He's doing much better now. She's recovering slowly but steadily. The swelling has gone down. The pain is under control with medication. And if someone went to the hospital, you might ask, did they run any tests? What did the doctor say? Are you on any medication now? Let's also talk about lessons learned. In English, it's common to reflect on an experience by saying things like, it made me realize how important first aid knowledge really is. Next time, I'll make sure I have a better first aid kit. I learned the hard way that I need to stay calm in emergencies. These are all part of a natural way to tell your story and talk about what you would do differently next time. The phrase learned the hard way means you had to go through a difficult experience in order to understand something. Another helpful phrase is in hindsight. This means when you look back at something, you understand it better. For example, in hindsight, I should have called for help sooner. In hindsight, having gloves in my kit would have been useful. And what if someone wants to thank you for helping? You might hear, I really appreciate what you did. Thanks for being there, it meant a lot. You handled the situation so well. A natural response in English would be, I'm just glad I could help. Anyone would have done the same. I did what I could. These kinds of exchanges are common after emergencies, and they help you communicate with kindness and humility. Here's a full example of how you might describe things afterward. After the incident, I checked in with her the next day. She had some bruising and soreness, but no serious injuries. In hindsight, I should have reacted faster, but I stayed calm and did my best. She thanked me for helping, and I said I was just glad she was okay. It really reminded me how useful basic first aid knowledge can be. So even when the moment has passed, the conversation continues. Whether you're following up with a friend, sharing your experience, or reflecting on what went well or what could have gone better, having the right English expressions makes you more confident, more thoughtful, and more effective. To wrap up our deep dive into first aid, let's explore one final but essential part of being truly prepared: communication with professionals and using English in medical environments. When paramedics arrive, when you go to the hospital, or when you help someone give details to a doctor, your ability to explain what happened clearly can make a big difference. Let's start with how to give a summary of an incident. In English, this is called giving a report or providing background. You'll often need to describe what happened, when it happened, what you did, and how the person responded. Here are a few phrases you can use. The accident happened around 3 p.m. He fell off his bike and hit his head. I checked his pulse and he was breathing but unconscious. I cleaned the wound and kept him awake until help arrived. Medical professionals may ask you follow-up questions. You should be ready to answer things like, was the person conscious when you found them? Did you notice any bleeding or swelling? How long was he unresponsive? Did he complain of any chest pain or dizziness? Notice how the structure is often in the past simple or past continuous. He was shaking and looked very pale. She wasn't able to move her leg. They were driving when the crash occurred. Another helpful phrase is, as far as I know. This is used when you give information you believe is true, but you're not completely sure. For example, as far as I know, he didn't hit his head. As far as I know, she has no allergies. Thinking of allergies and medications, if you're helping someone who can't speak for themselves, these are important details to share. You might say, he's allergic to penicillin. She's diabetic and takes insulin. He takes medication for high blood pressure. These kinds of statements help doctors give the right care without delay. And even if you're just interpreting for someone else, being able to say it clearly in English is incredibly valuable. It's also helpful to know how to ask for clarification when you don't understand medical terms. Simple, polite questions like, sorry, what does that mean? Could you explain that more simply? Is that serious? These show that you care and want to understand, which builds trust. And finally, after everything has been handled, it's perfectly natural in English to express relief or appreciation. You might hear, thank goodness the injury wasn't worse. It could have been much more serious. We were lucky someone knew what to do. Or you might say, I'm glad I remembered my first aid training. It reminded me how important it is to stay calm. Let's close with a full example that combines all of these elements. When the paramedics arrived, I gave them a summary. I told them the man had fallen, hit his head, and lost consciousness briefly. As far as I knew, he wasn't allergic to anything. I kept him awake and still until they got there. They thanked me for staying calm and giving clear information. It really showed me how valuable even basic first aid knowledge can be. Knowing how to speak clearly and naturally in a medical emergency is one of the most practical ways to use your English. It's not about perfection, it's about being calm, confident, and helpful when people need it most. Thank you for being a part of the English Podcast Zone.
Hey Joe, where have you been these past few days?
I've been busy with a first aid course that I started about a week ago at the Red Cross.
Cool! I've always wanted to do something like that. Have you learnt anything useful?
For sure. I mean, we learned how to apply pressure to stop bleeding, how to check for a pulse, and even how to apply CPR.
Have you treated any real emergencies?
Well, they took us along with some paramedics. There was this guy who fell off his motorcycle and suffered a concussion as well as a couple of compound fractures. His wounds were pretty serious, so they had to rush him to the hospital. It was intense.
I can imagine. I tend to faint when I see blood, so I think I won't be taking up a course like that anytime soon.
All right, we're back. So that's all the time we have for today. Be sure to do your homework assignment. Come to EnglishPod.com. In the comments section, tell us, what do you tend to do?
Could be a good thing, could be a bad thing. Obviously, you can try and use some of the vocabulary you heard in today's lesson about health and safety. And you might get some extra points from us for doing that.
I know some people who tend to leave the house with a whole medicine kit in their bags or in their purses.
Really? We could say a first aid kit.
A first aid kit, exactly.
Wow. So do you do this? Let us know. Our website is EnglishPod.com. That's all we've got for today. So until next time.
Bye.
Bye, guys.
The English Pod Audio Review. Listen to the meaning, then say the vocabulary word.
To cure an illness by medical means. Treat. A jarring of the brain. Concussion. To be disposed or inclined towards something. Tend to. Move or act swiftly. Rush. Begin with. Take up.
Let's try that faster.
To be disposed or inclined towards something. Tend to. Begin with. Take up. A jarring of the brain. Concussion. To cure an illness by medical means. Treat. Move or act swiftly. Rush.
Now say the word and hear it in a sentence.
Treat. I think you should go to the doctor and get treated for that rash. Treat. John is currently being treated for his wounds at the local hospital. Treat. Many patients in this clinic are being treated for swine flu. Concussion. I suffered a mild concussion when I fell off my skateboard. Concussion. A concussion is a brain injury that is caused by a sudden blow to the head or to the body. Concussion. I think you might have a concussion. We should go to the hospital. Tend to. My teacher always tends to undermark my tests. Tend to. All my friends tend to ignore me since I broke up with Andy. Tend to. Don't use this CD player. It tends to damage the discs. Rush. I'll do the dishes when I come back. Now I have to rush to school. Rush. I would like to stay with you, honey, but I have to rush to work. Rush. My grandma had a heart attack this morning and was rushed to the hospital. Take up. After my boyfriend criticized my cooking, I decided to take up a cooking class. Take up. I decided to take up Spanish since I might move to Ecuador in the future. Take up. I would like to take up guitar lessons, but my parents want me to start playing the piano instead.